Okay, Fatima, you have the floor. Go ahead.
Hmm. Okay, Assalamu alaikum everyone. Hope you're all doing well. Today our topic is about sparkling smiles. So, can anyone tell me why it is important for us to brush our teeth? Okay, so we brush
It's
our teeth
important to brush our
yeah,
teeth because it's important to brush our teeth because if we don't brush our teeth, how will you eat?
yeah, exactly. Because then our teeth will become infected and it will lead to decay and it will be difficult for us to eat. Yes, very good, Ibrahim. So, why are teeth important for us? Can you think?
So
Let's brainstorm. Yeah,
we can like bite stuff with an apple to eat food.
very good. Good job. Yeah, exactly. So, basically, we use our teeth for masticating food, for chewing, and it helps us to break the food into smaller pieces. So, apart from that, it helps us in aesthetics. Like when we smile, we look good, right? With our teeth. And also because for our oral hygiene, they maintain our oral hygiene if we brush our teeth, and they help us to eat. And yeah, okay. So we're going to, okay. So why is it important for us to take care of our teeth? Can you look at this first picture? This one?
Yes.
Yeah, so what do you think is wrong in the first picture, and what about the second picture? Which one is more pleasing to look at?
The
Second.
first picture is is the first picture uh, is is not good because they did not brush their teeth properly, and the
Yeah,
second
Exactly.
I agree.
picture is good because they brushed their teeth properly.
Exactly. Or also, do you see the color difference? The color
Yeah.
difference in the teeth.
One is
Yeah,
Yeah.
yellow, one is white.
that's that's what how I could infer that.
Yeah, this picture has yellow teeth, and you can see the yellow. It's basically called calculus and plaque. And the second picture, this is white teeth, bright smile. So the first picture is not very pleasing to look at, and it looks gross. So what is calculus and plaque? Let me show you guys. Okay, so okay. So, basically, there are two types of terms called calculus and plaque. Do you see this yellow thingy here below the teeth? This is called plaque, which
Yeah.
gets accumulated when we don't brush our teeth. The yellow thing, these are basically food particles that get stuck in this gingiva, the gums. Do you know about gums? Gums are basically the structure that support our teeth, these pink area. Do you see when you open your mouth, this pink area in your whole mouth? Okay. So, what is plug? Plug is a soft, sticky material here. And calculus is basically when it stays for a while and the patient and the child or the patient does not take care of the teeth, it converts into calculus and it becomes hard. It's very difficult to take off. The plug we can remove by maintaining our oral hygiene by brushing and flossing. But the calculus, it gets very hard and it can be removed through brushing and through flossing. So when we don't take care of our hygiene, do you see this? This blackening and this yellow, this is basically
Yeah.
and it won't come off. And this is plug. It can come off if you brush your teeth and you take care of them. So what sometimes there's do you know about bacteria? there there is a microorganism, tiny microorganism in our mouth, and we have to repeatedly take care of our oral hygiene so that these organisms can they can't spread the infection. Okay, So basically, do you see this? These black images.
Yes.
Yeah, what's wrong with them? Can anyone tell me?
They are like black and
They
they
do
have
not
like
brush their
holes.
teeth.
Yeah, they
They
have
do not brush
cavities.
their teeth.
Yes, they have cavities in them. This is called caries. Caries is something that is caused by bacteria. Bacteria is a very tiny microorganism that lives inside our mouth. We have to brush our teeth to get rid of that bacteria. Okay? So, if we don't brush our teeth, then these cavities they will form. Do you see this? They look really bad, and all of these are the cavities.
It could be
Okay.
the case that that person was brushing his teeth with chocolate milk instead of the toothpaste.
Yeah, yeah. So basically, when you eat too much sticky food, like chocolates, and you're drinking too many cold drinks, and you're not eating the proper food, and you're not brushing your teeth while you before sleeping and in the morning, and you're eating candies, a lot of candies without brushing your teeth, this happens. This if you eat a lot of sticky food. Okay. So first we are going to learn about what okay, okay. So this is the upper teeth. Do you see we have a jaw and there are two parts of a jaw, maxilla and mandible. Mandible is the lower one and maxilla is the top one. We are going to review the names of the teeth. So these the front ones, let me show you in another picture. The front ones are called incisors. These one. Okay, let's see. These two, the bigger one, these are called central incisors because they are in the center part, right above our nose, in the midline. Midline is this right here beneath our nose. These are the central incisors. These will be the lateral ones. These four are the incisors, canines. These are the canines. Why are they called the canines? Because they are used for ripping. Like when we bite something, when we bite a burger or anything, it helps us to tear the food. Canines are very important. These are the third one, the canines. Okay, first I'm going to tell the names and then can someone repeat it so that I know that you guys are listening? Okay, so these are the incisors, these four. Okay, and this is the canine. These two will be the premolars. Premolars means before molars. Okay, first premolar and second premolar. And these are the molars. Molars are used for chewing food. Basically, we bite food through our front teeth and this canine, and then we chew them with our back teeth. Okay, so can anyone tell me the names? This is the maxilla, the upper part, and this lower part is the mandible. Okay, so can anyone repeat it? It's okay. It's okay. These are a bit difficult terms, and inshallah, you'll learn them later on. So this is the maxilla, and this is the mandible, and these are the incisors, canine, premolars, and molars. Okay, very good. Okay, so these are the same teeth: incisors, canines, and these are basically the milk teeth. Do you guys know about the milk teeth and the permanent teeth? Can anyone tell me?
The milk teeth kind of have like something on it.
Yeah, basically there are two kind of teeth: milk teeth and permanent teeth. Milk teeth come when you are below the age of 6. They fall off, and then the permanent teeth like come after that. So milk teeth are basically they're not very strong, and they start growing when you're 6 months old. And when you from 6 months to 6 years, you have these milk teeth, and then they're replaced with permanent teeth. Okay, why are they replaced? Because the milk teeth are not too strong, and when you grow up, you they fall off and get replaced by permanent ones because they are more stronger and they are more wider. Okay, so okay, so why apart from brushing, what do you think we should do to clean our teeth?
Flossing.
Very good. Flossing and mouthwash. Basically, mouthwash is for adults. When you become adults, you'll start. Mouthwash is used for bad smell. When someone has bad smell and then they use mouthwash. Okay, so flossing. Why do you think we should floss? Like, okay, brushing is basically when we clean this is the front part is the buccal side and the part which is on the other side is the lingual. So
I think we should clean the ring well. That's where the flossing is.
yeah, okay, the spaces between the teeth, these are called interdental spaces. Interdental means between the teeth. Between two teeth, these spaces, we cannot get the brush bristles inside them. So we use the floss in order to clean these out, these spaces between the teeth. Basically, this is what a floss is used for. So, okay. So, do you know why flossing is used? To clean between the teeth. Okay? Okay. So, what is the right kind of food that we can eat to make our teeth healthy and strong? What do you
Health-
think?
Healthy food.
Yeah, like
Apples and bananas.
very
Onions,
good.
onions and
Yes.
tomatoes.
Very good. We can eat fruits and vegetables. And what food are the food that aren't good for our teeth? Those would include sugary food, like too much sugar, not natural sugar, but canned sugar, any chocolates, candies, fast food, a lot of sugary milk. If you put too much sugar in it, and chocolates and chips. If you eat a lot of chips, that will cause tooth decay. That would basically lead to a lot of bacteria in your mouth, and when you don't brush the teeth, they will stay there, and it will lead to formation of plaque. You saw the plaque pictures, right? The yellow, yellow teeth, which I showed you the picture of. So when we eat these food, basically, the vegetables and the fruits and some calcium food are very good for our teeth. The bones are made up of calcium, right? You know what calcium is? Okay, calcium is a nutrient which is very important for us. It helps to make our bones stronger. So teeth are also a part of bone. And when we eat calcium-rich food, they help our teeth to grow more stronger. Okay, so drinking plenty of water, it also helps our teeth. This is very interesting, right? If we drink a lot of water, it also helps to clean our teeth. Why? Because first of all, if we have a lot of bacteria in our mouth and we drink water, it will cleanse those bacteria. It will make them it will wash them away. And if there are any food particles that are stuck in our mouth, it will also wash them away. And apart from that, if there are any deposits of food, anything stuck between our teeth, and we drink water, it can make it go away.
What about the orange
So,
juice?
orange juice is also good.
Like any kind
But
of
you have
juices
to,
can
yeah,
wash
no,
them away.
and not all kind of juices, not sugary juices. Like fresh orange juice is very good, but if you drink from a soda can or any tin, or the carton juices, you have to brush your teeth afterwards. Those are sugary juices. Any sugary juices or cold drinks, they lead to more accumulation of plaque and bacteria in your mouth, and they make the
Fatma,
teeth
normal
structure
juices
sticky.
also have a lot of natural sugar. Like all fruit
Yeah,
juices have a lot
but
of
that
natural
is
sugar.
yeah, but that is natural sugar, and the other sugar. There's a difference between them. So, if you yeah,
Added
if
sugar.
you
You
drink
mean the
normal,
juices with added sugar aren't good for us?
exactly, that's more bad. But if you drink normal, normal based sugar juices, the best thing is to brush your teeth afterwards. But water is the only thing that you don't have to brush your teeth after drinking water. So basically, the
Natural.
natural juices, the homemade juices, they are more fresh and they're very good for you. But still, you have to brush your teeth after you drink them. But you have to brush your teeth 2 times a day. First in the morning. Can someone tell me when's the best time to brush your teeth?
In the morning,
Okay,
like after you wake
very
up.
good, very good. And the
I
second
mean,
time?
I prefer doing it after
In the
breakfast.
evening, same.
Yeah. Very good. Before you go to sleep and after you wake up. After it, dep- there is not a fixed timing for the morning, but in the night, before you go to sleep, you have to brush your teeth. Why? Because when you're sleeping, your mouth remains closed. And if you have eaten anything, all the bacteria inside your mouth, they will start the process of decay. And they will make your teeth more stickier, and you have to always brush your teeth before you go to sleep. That's a huge tip. So always brush your teeth before you go to sleep and after breakfast or before you wake up. It doesn't really matter in the morning. You can either brush your teeth before breakfast or after breakfast, basically after breakfast, and at night before you go to sleep. Okay, so if there is some pain in your teeth and if there are caries, so and if there anything wrong with your teeth, where do you think we should go to?
The dentist.
The dentist.
Yes, very good. Why? So that they can treat our teeth and they can tell us what's wrong with them and they can help us with our oral hygiene. So, yeah. So, and now, do you guys have any questions?
I have a question. Do we
How
know
Yes.
how
that
do
the
teeth form?
yeah, go ahead, Ibrahim.
Yes, Ibrahim?
How do teeth form?
Can you repeat your question?
How do teeth form?
How are teeth formed?
Yes.
Very good question. Basically, there are tooth buds inside our mouth. When we are babies, all these buds they grow and then they form the milk teeth when the baby becomes 6 months of age. Basically, they grow from a tooth bud. All the buds are there already inside your mouth. And when you become 6 months of age, then the first milk tooth forms. Does
What's
it answer your
fluoride?
what's a tooth bud?
What's fluoride?
Can you repeat?
What is fluoride?
Fluoride?
Yes.
Okay, so basically, fluoride is very good for our teeth. You see, there is fluoride in toothpaste. Have you ever seen the ingredients of a toothpaste?
Yeah.
Yeah, it contains a lot of nutrients. It contains a lot of salts like fluoride, salts, sodium, bisphosphonates, and stuff like that. All difficult names, right? Fluoride is basically a very important component. It helps protect our teeth. Our teeth are made up of these hydroxyapatite calcium-based crystals, and fluoride is the component that helps to protect the upper layer, which is the enamel. Okay, I'm just telling you for information. If you guys can remember it, that would be great. But there is an upper portion of our teeth called enamel. That's the uppermost layer. So fluoride, when we use it, it helps to protect the upper layer, and it gets like they make the fluoroapatite crystals. They bond together the teeth, and they help to protect the upper layer against bacteria. Okay, did that answer your question?
Yes.
Can
Okay,
animals
great.
get cavities
Okay,
like
so
humans?
yes. And the funny thing is that the animals, they can brush their teeth or take care of them. So yes, it can lead to decay.
But they can't do anything if they are in,
Okay,
like,
so
in the woods. Like,
yeah, basically the water that they drink and the food that they eat, that also leads to decay. So it depends on what kind of food that they're eating. But yeah, it leads to decay
okay, that
Does
answered my
water
question.
help
if
teeth?
they're not.
But now
But
someone asked in the
yes,
questions, is Maswak toothpaste better than fluoride
Does water
toothpaste?
help teeth? Does water help
Ibrahim,
teeth?
can you repeat? Let me open the chat.
Does water
Does
help
water
teeth?
help teeth? Yes. It's self-cleansing. Yes, it helps teeth. It's self-cleansing. And also, it also dilutes the acidic drinks that we have, like that we drink. It dilutes the acid, so it helps it helps in cleaning. It helps to remove the bacteria, and it helps to remove all the food particles that are stuck in our mouth. It's self-cleansing. So yes. Okay, is Maswak toothpaste better than fluoride toothpaste? Maswak toothpaste. I think. Um, are you asking about Maswak or are both of these toothpaste? If the Maswak toothpaste has fluoride in it, then it would be better. Because fluoride, unless you have fluorosis, which is a tooth condition, then you can't use fluoride, or else fluoride is best for usage. Was becoming a dentist hard? Yeah. Should I answer honestly or should I lie? Okay. It was a bit difficult at first, but then um, Alhamdulillah, now I'm fine with it. It was very difficult at first when I didn't know how to figure out everything, and it was a lot of burden at first. And okay, so are there any more questions? Yes. Now that I think of it, yes, I think it's okay. It's okay. Okay. Are there any more questions? Okay, so we are going to watch this video. I hope it helps. This is a very good character, Dr. Binox, and I really like him.
I like him too.
Me too.
Okay, so this is a bacteria that's inside our mouth, and it's usually there inside our mouth because uh, bacteria, they can get, they're usually present on our skin and our faces. So when we eat something, our mouth opens and bacteria gets in. So it resides inside our mouth. Now they're going to tell. Okay, so the first layer was enamel, and the second layer is dentine. So what happens when the germs attack? They first attack the enamel, first layer, and then they attack the dentine. Flossing basically also help in gum regeneration. Gum regeneration means when you're getting older, the gums inside your mouth, they start to like regress. They start to go down, and your teeth start to become loose. So if you do floss like every 3 times in a week or 4 times in a week, that would lead to gum growth, and it can help your teeth and also in gum healing. Okay, so are there any more questions?
Thank you, Fatma. We are at time now, and thank you for presenting it.
Do we have to go to dentist every 6 months, or we can skip too?
I think it depends. Like, if you're taking good care of your teeth, you don't have to. You can go to the dentist once a year. But if there is a problem, like you see a black dot of caries or plaque or calculus, or there is pain in your teeth, or there is another something like injury in your gums, or your tongue is hurting, or anything like that, then yes, you can immediately go to the dentist. And don't let the caries get make the tooth like don't let it make a cavity. So go before, and then you can get scaling done. Okay, and you can first, there are preventive measures like take care of your oral hygiene, floss daily. Not daily, like yes, you can do it daily, but the proper way of flossing, you have to watch YouTube videos for it. There are specific ways to floss, and then you can use mouthwash, and you can eat proper food, and eat less sugary food. Apart from that, then if there is some plaque or calculus, you can get scaling done. And after scaling, if there is cavity on your occlusal surfaces, the part from where you bite, the top part, if there is cavity there, then you can get filling done. But if there is pain inside your teeth, then you can't have filling. Then it would lead to it basically, if the caries go inside your pulp, which is the third layer. After dentine comes pulp. Pulp is where there are nerve endings. So basically, when your tooth is hurting, it means that the caries, the bacteria, have reached inside the pulp. So when they reach inside the pulp, that's when you have the problem. Then you would have to go for root canal. If it has basically, pulpitis is an infection which is caused by bacteria inside the pulp. So it can be irreversible or reversible. Irreversible can get treated by antibiotics. It might, but reversible can get treated by antibiotics. But irreversible, it has to get treated through root canal. Okay,
And thank you
so
very much. Sorry, yeah, please go ahead.
okay, so why? So to summarize this lecture, I'm going to tell some other points that why is it important for us to maintain our dental hygiene. There are some oral diseases that also occur if we don't take care of our teeth, such as periodontal diseases. Periodontal means diseases related to gums, like there can be infection in the gums, okay, if we don't take care. And if we don't take care of our teeth, we can develop halitosis. Halitosis is severe bad smell from your mouth, and it can provide discomfort to you and to other people as well. And it's not very nice, to go out in public and have bad breath. So also, if you neglect your oral hygiene, you can also develop other diseases, respiratory diseases or heart diseases, like endocarditis or other diseases. Um, yeah, and we yes, Ahmed bhai.
I just wanted to tell you that the meeting is going to end in 1 minute, so we have one last minute.
Okay. Is there a question? Is there a
No,
question?
yep. I think the question
Okay.
was answered. Yeah. With that, we are at time. Thank you very much, Fatma, for presenting it. Really appreciate that. and everyone who joined. I'm gonna stop the recording now.